This is everything you need to know about taking a GLP-1. I'm Dr. Jonathan Kaplan. I'm a GLP-1 educator and provider. You may have seen some of my videos on TikTok and Instagram. Across our Dr. Well network, we provide thousands and thousands of patients many different medications, including GLP-1s, but also hormone therapy and longevity medications. So hit that follow button so you can learn how we can help you live your healthiest life. We offer semaglutide and tirzepatide, the active ingredients in Ozempic and Mounjaro, respectively. But we're getting them from a compounding pharmacy, which makes them much more accessible and less expensive than the name brand drug if you're paying out of pocket. If you think about a traditional pharmacy, they get medications from a traditional manufacturer like generic or name brand drugs, whereas a compounding pharmacy takes the active ingredients from those same FDA registered manufacturers but personalizes it for your use. So let's talk about who's a candidate. Traditionally, you had to have a BMI of greater than 27 with a comorbid condition like diabetes or high blood pressure, or a BMI of greater than 30, which would be morbidly obese. But times have really changed, and it all comes down to the risk-benefit ratio. So for example, if you're 400 pounds trying to get to 250 pounds, if there's a risk of pancreatitis, you're probably willing to take that risk to get from 400 to 250 pounds. But if you're trying to get from 130 pounds to 115 pounds, then that risk of pancreatitis is untenable. But what we found after offering these medications for several years is that risk of pancreatitis is extraordinarily low, that the benefits clearly outweigh the risk. So we no longer have a BMI criteria. The people who are not candidates are people with a history of medullary thyroid cancer, which was mostly seen in lab rats associated with these medications, but also somebody that has an eating disorder like anorexia. If they have an eating disorder like binge eating, then these medications can be very beneficial. And then if somebody has had pancreatitis due to these medications, then they also would not be a candidate. But everybody else really is. So once you're ready to start your journey with Dr. Well for either weight loss medications, hair loss, longevity, or even sexual wellness, you go to drwell.com to the provider finder, and then you can reach out to a provider and actually have a consultation with them via an in-person consultation, a virtual consult, or even fill out a Dr. Well Smart Consult, which is like an asynchronous consultation where you fill out a questionnaire and then the provider reviews that questionnaire. And in 32 states, that's the only consultation you need. After they review it, they send you a link to sign up for the medication, which are then shipped directly to you. Once you receive your medication on ice, put it in the fridge, and then reach out to your provider and schedule an injection training, which can be done virtually, where they'll show you how to pull up the medication out of the vial so that you don't overdose or underdose, and they'll show you how to do the once per week injection. You'll take that injection 4 times a month, and each month you'll be charged again to have the medication shipped out to you, but each month the dosage will increase just like the name brand drug regimen, and it'll continue to increase each month until you get to the max dose, or until you get to a dose where you're losing weight, not having side effects, and then you can certainly stay at that dose. If you have any questions about GLP-1 medications that I didn't cover, please ask in the comment section below. And if you're ready to get started, go to drwell.com, find a provider, and you'll find a provider near you within your state, and they can make it very easy for you to sign up online and get medications delivered to your door within a couple days.